PolyMem dressings support wound healing through each step of the journey to recovery. As wounds heal, they move through the overlapping phases of inflammation, proliferation, and remodeling. Inflammation is characterized by redness, warmth, swelling, pain, and even loss of function in the wounded area. Prolonged inflammation causes the body to form slough. Prolonged inflammation, due to debris, infection, dryness, excess moisture, or ongoing damage, can lead to stalled wound healing, resulting in chronic wounds. PolyMem continuously cleanses and debrides, balances moisture, and protects the wound bed, addressing many of the causes of prolonged inflammation. In addition, PolyMem calms inflammation directly. With PolyMem, swelling, persistent and procedural wound pain and slough resolve, therefore function is restored. During the proliferative phase, new tissue and capillaries are formed, wounds contract, and epithelialization closes the wound. The proliferative phase is fragile. If the wound bed gets dirty or infected, too dry or too wet, or too damaged, the wound can move back into the inflammatory phase, which can result in a stalled or chronic wound. PolyMem dressings maintain close contact with the wound bed, continuously supporting the wound by keeping the wound bed clean, maintaining appropriate moisture balance, and limiting inflammation caused by any new damage. Studies demonstrate that PolyMem dressings encourage granulation tissue formation, wound contraction, and brisk wound closure. During the remodeling phase for wounds deeper than superficial, the tissue that makes up the scar is reorganized to make it stronger. If the scar tissue is too dry, too moist, or is repeatedly damaged, it will become inflamed, which can prevent successful remodeling. This can result in weak scar tissue, persistent redness, swelling, discomfort or pain at the site, or more prominent scar tissue. After wound closure, many clinicians continue to use PolyMem for several weeks to protect the scar tissue, maintain appropriate moisture, and control inflammation. This supports the development of a strong, smooth, less noticeable scar. The components of PolyMem dressings work with the body to control inflammation, reduce pain, and increase wound healing through each step of the journey to recovery. PolyMem dressings are the optimal choice for supporting wound healing from start to finish.